Dr. McDonald, what is the current status of physical activity in patients with arthritis?
So unfortunately, it's not great. So only about 40% of patients with arthritis are actually meeting physical activity guidelines. And the most important thing is just getting patients moving. And as many people address, is the fear of worsening their pain or exacerbating their joint disease is really holding a lot of patients back from being as physically active as they need to and meeting those guidelines of 150 minutes of moderate aerobic exercise a week.
And what are the actual risks of inactivity, especially for patients with arthritis?
Oh my goodness! So just the number of chronic medical conditions which are impacted by physical inactivity is vast. I mean, if you go on the Exercise Medicine website and look at the list of different chronic medical conditions, which exercise is either a part or a component of either, if not routine treatment or first-line treatment, or treating the side effects from a lot of other chronic medical conditions, exercise is critically important, and I can't emphasize enough how often we need to get more involved, get our patients more involved, no matter what their physical disease state is. Whether they're healthy, we can keep them healthy by getting them physically active, or if they already have a chronic medical condition, we can improve the side effects, we can reduce the symptoms by getting physical activity as a vital component of their daily and weekly activity.
And you just mentioned exercise medicine. What is that all about?
Sure. So Exercise Medicine is a global initiative which was launched in 2007 and quickly spread to 40 countries and 7 centers throughout the world, multiple different languages, including some in Europe. It's a web-based tool which can provide a huge amount of resources and guidelines, evidence-based guidelines for both physicians and clinicians as well as patients in terms of prescribing exercise. So there's a whole section where you can give people various amounts of exercise and literally give them an exercise prescription, and then that will also connect them to local healthcare resources and other professionals and paraprofessionals that can help them with their physical activity and keep them healthy as well. Or if they have a chronic disease and we need to be a little more nuanced and careful about how we get them physically active, there are a lot of professionals which can help there as well. So it's a great resource for people, professionals and lay people around the globe.
And what types of exercise would you recommend for people that sometimes have inflamed joints or like are suffering from arthritis?
Sure. So people that are sort of, when their joints are acutely inflamed, I recommend stretching, range of motion, and sort of open chain exercises. The common example I use is people with knee arthritis, just single straight leg raises, where they're not actually bearing any weight on that joint, but they're still engaging and activating the muscles surrounding the joint without a lot of weight bearing. That's really critical, especially when they're kind of in that inflamed state. However, people when they're not as inflamed, particularly with arthritis, less weight bearing things. So yoga and stretching hugely beneficial in terms of treating multiple different physical ailments and arthritides. Then, in addition to medication, ice, those types of things are always very helpful. And then getting them active in a non-weight bearing type of way. So cycling, swimming, those types of exercises where they're not load bearing can be really beneficial as well.
You mentioned in your lecture that you would prescribe the medicine over any pill. Do you think that people that actively exercising can help the status of arthritis so that the joints are not inflamed so often and things?
Absolutely. So actually one of my other research projects I'm working on right now is tracking patients' physical activity with their sort of healthcare utilization, and one of the parameters we're looking at is number of prescription medications and number of refills of those medications. And we found across the board people that are meeting physical activity guidelines of 150 minutes per week are prescribed less medication, are going to the pharmacy less often, are having less primary care doctor visits for inflamed joints and other problems. So across the board, physical activity will reduce the burden of disease on any patient population.
You said that doctors should also lead by example.
Absolutely.
Can you just say a little bit about that?
Sure. So I think it's really important that we sort of talk the walk the talk, what have you. That we're physically active, that we're taking the stairs, that we're ideally walking 150 minutes per week or doing some physical activity. I think it adds a layer of credibility when we engage patients and when we talk to patients. Even if it's not necessarily what's right for the patient, you can sort of lead by example and do as I do, not as I say. Is always one of those things I'm reminded as a parent. You're telling your child to do this, and you're like, but Dad, you did that. So keeping people keeping it centered around being physically active and showing that it's okay, showing that I'm doing it too. Like I practice what I preach is really critical.
How can doctors motivate their patients when they are actually really inactive? What are your recommendations to fellow doctors?
Well, I recommend that the fellow doctors get more active. So again, starting small, take their own advice. You know, starting small, doing some stretching, some yoga, and then building in some aerobic exercise and walking, some cycling, and then doing some strength training and sort of incorporating it slowly. I think the mistake a lot of people run into is they, one, they don't make it fun, so they stop doing it, and two, they try to do too much too soon. So keeping it reasonable and starting at a low level and sort of not getting overly motivated and overly enthusiastic and doing too much too soon they end up right back on the couch again. So patients and physicians alike, I think, are susceptible to that.
It seems to be a lot of responsibility for doctors and physicians to actually motivate people to exercise or to physical activity. How much help do you get from, I don't know, federal programs or the media to raise the awareness across patients?
Sure. That's a great question. It's really challenging as well. I mean, I think we are not necessarily fighting, but we're competing with patients' interests. There's so many other things going on. There's this, there's that, there's the latest game, there's the latest gizmo. So I think now we're reaching sort of a point where people are more aware they need to be physically active. They know it. We just need to take that next step and actually get them to be physically active. So there's not a patient encounter that goes past where I don't talk about physical activity. And then with that hand-in-hand nutrition as well, and reminding patients to be physically active and saying, hey, look, you know, I did my run this morning. You need to go to the gym or do something else. And I think the other piece too is really making it fun, as I mentioned before. If it's not fun, they're not going to continue doing it. So doing something you love, doing it with people you love, and the more you do it, the easier it becomes, and becomes a sort of a positive upward cycle.
Okay, Dr. McDonald, thank you very much for your time.
Thank you so much. Appreciate it.